I'm Ben, I'm a chiropractor. This is my brother Sam. He's a yoga instructor, an experienced yoga instructor. We're just going to talk about what cues that we give people to approach lifting a heavy or awkward object, or actually any object at all, because it's such a common source of injury. So the first thing I tell one of my patients is to come as close to the object as possible. Commonly you'll hear about bending the knees, always bending the knees, which is correct, but I always get a patient to be really focused on using their hips. The difference is that if we just bend our knees, we can sometimes get in a really awkward position, but if we think about our hip position, it enables us to put us in a strong position for the lower back. So I'm going to lift. So what I've first done is I've moved through my hips. So I'm taking the butt back here, and then as I'm lifting, I'm using butt, pelvis, hip movement to get the weight up. The worst thing that I would be concerned about for patients generally is them bending with their back and then lifting with their back. I don't even want to do that because I can feel it quite straining. So I give the cues of use your butt first, bend the knees, bring the weight close to your body, and then lift.
Oh, okay, great. So from a yoga perspective, we would start with the concept of bandha, which means creating a co-contraction around all your joints. So from the ground up, Ben actually talked a lot about awareness around hips, which from a yoga perspective is great, but I would actually start with the feet. I would say create bandha around your feet by making sure there's as much weight back in your heels as there is in the balls of your feet, and the toes are just there to stabilize. And then if you do bend to pick up your object, then your hips and your knees stay broad out over your ankles, so then there's that contraction using all the muscles that are supporting the joint evenly. And then I guess from the yoga perspective, the thing that's the most important thing that we emphasize in our classes, or when I teach, because in today's society we tend to be very lazy through our belly unless we're feeling stressed, and then we create stress. But if you can consciously draw your belly in to create support for your lower back, then you can actually bend and lever and support from underneath. So right now my belly is drawing in towards my spine. I'm even lifting my pelvic floor, so there's that gentle squeeze up, like you're trying to stop yourself going to the toilet mid-flow. So those things are happening to me right now, and I feel confident in actually bending and picking up with my back supported with my belly.
Excellent.
Great.
Nice work.